And at the outset, I would like to thank the organizers for the opportunity. I'm here to talk about the gap between nursing research and nursing practice, pediatric nurses' concern. The integration of nursing research into clinical practice is essential for developing and delivering quality care, evidence-based care, particularly in pediatric nursing, where the needs of young patients and their families are unique and complex. Despite the wealth of research available, a significant gap often exists between what is known and what is implemented in practice. Factors such as limited awareness of the current research, contribute to this disconnect. By actively engaging with research, advocating for evidence-based practices, and participating in collaborative efforts with researchers, pediatric nurses can enhance the quality of care provided to children. Furthermore, their role in educating families about evidence-based interventions fosters a supportive environment that encourages active participation in care decisions. So, some of the factors which we need to think are lack of awareness. Many nurses may not be aware of the latest research findings and how to access them. Time constraints. Nurses are busy with the clinical workload, and nurses often face heavy workloads, leaving little time to engage with research or implement the new practices. Educational barriers. Not all nursing programs emphasize the research or evidence-based practice, leading to variability in knowledge and skills among practitioners. Institutional resistance. Sometimes this is also one of the factors which hinders. Some healthcare institutions may resist changing establishing practices, making it challenging to integrate new research findings. And communication gaps. There can be a disconnection between the researchers, practitioners, the teachers, the nursing faculty, with research findings not being effectively communicated in a practical context. When they work together as a team, then they can be give and take, and where there can be translation of research evidences into practice. Lack of resources is the other important factor which we need to bear in mind. Limited access to resources such as research, database, or continuing education can hinder nursing ability to stay updated. So bridging this gap, fostering a culture of evidence-based practice is so important in the pediatric nursing field. So the gap between nursing research and clinical practice is a well-documented issue that affects healthcare delivery across various specialties, including pediatrics. Despite advancements in research methodologies and a growing body of evidence, the translation of research findings into everyday clinical practice remains a challenge. This gap can lead to a suboptimal care where patients may not benefit from the latest evidence-based interventions, ultimately impacting health outcomes. So in pediatric nursing, this gap is particularly critical. Children are not simply small adults, they are angels. They have unique physiological, developmental, and psychological needs that require tailored care approaches. The complexity of pediatric healthcare demands that nurses not only stay informed about the current research, but also apply it effectively in their practice. However, the barriers such as time constraints, limited access to research resources, and inadequate training in research utilization often hinders this process. Pediatric nurses frequently serve as advocates for their young patients and their families. This role positions them to identify gaps in care and to push them for integration of evidence-based practice into clinical settings. By fostering strong relationships with families and engaging in open communication, pediatric nurses can better understand the needs of their patients and challenges they face, thereby promoting a collaborative approach to care that is informed by research. Recognizing these factors is essential to explore the specific strategy pediatric nurses can employ to bridge the research practice gap. By doing so, it can enhance the quality of care pediatric patients can receive, making it evidence-based one. There are many studies which prove the gap. A study by Malutin et al. In 2014 examined the barriers that nurses face in implementing evidence-based practices. The findings highlighted issues such as time constraints, lack of access to research, and insufficient training in evidence-based methodologies. Knowledge translation in pediatrics, the systematic review by Brawl and Grimshaw in 2003 focused on knowledge translation strategies in healthcare, especially in pediatrics. The review identified effective interventions for bridging the gap, including educational outreach and the use of clinical champions. Impact of continuing education. Research by Upton and Upton in 2006 found that continuing education programs significantly improved pediatric nurses' knowledge and application of evidence-based practices. The study emphasized the importance of ongoing professional development in fostering an evidence-based culture. Role of pediatric nurse practitioners. A study by Mott et al. In 2020 investigated the role of pediatric nurses practitioners in implementing evidence-based practices. The findings showed that these practitioners not only applied research findings in their clinical settings, but also served as leaders in promoting evidence-based care among their peers. Patient and family education. Research by Byrne et al. In 2019 explored the effects of involving families in care decisions based on evidence-based practices. The study demonstrated that educating families about research-informed interventions led to improved health outcomes and increased satisfaction with care. Collaborative practice models. A study by Uvirea et al. In 2016 evaluated the impact of interprofessional collaboration on the implementation of evidence-based practices in pediatric settings. The results indicated that collaborative models improve communication and enhance the application of research findings in clinical practice. These studies collectively underscore the importance of addressing barriers, enhancing education, and fostering collaboration to effectively bridge the gap between research and practice in pediatric nursing. So, I'd like to conclude that there is evidence that gap does exist between pediatric nursing practice and the research that go on in the field. In our own institution, in my own area, we have done some researches, especially the postgraduate students and even the nurses for that matter and faculty as well. And we have translated some of the evidences like where the effectiveness of oxygen delivery by nasal catheter or by tent method. And the research showed that nasal catheter method is far superior and therefore that is adopted. Likewise, so many examples were reported. Use of thrombophobe for extra infiltrations, IV infiltrations, where that was found to be superior than the ice application or involved result application. Use of amniotic membrane for burn care, and paracetamol versus paracetamol and temple sponging for children with fever, where there was no evidence to say that one was superior than the other, and therefore we have outdated the temple sponging process. Likewise, we can put so many examples where the evidences have been translated into practice. Even for obesity, the Zumba exercise and the teaching program are found to be very effective in bringing about reduction in BMI in children who are obese and mobile with that. Therefore, we are implementing that in the school health programs. So, bridging the gap between nursing research and practice is essential for improving patient outcomes in pediatric nursing. The existing literature highlights various barriers that pediatric nurses face, including time constraints, limited access to research, and insufficient training. And so we need to focus on the lacunae and improve on so that we will be able to provide quality care by translating the evidences into clinical practice. Thank you for the opportunity and God bless us all. Thank you.